Good morning, you're watching NTV and my name is Olive Burrows. As always, we are on the COVID-19 beat. This is our special coverage. Now bombarded by the dark reality of the rising numbers of lives lost to the coronavirus globally, which stands at 45,000. Tonight, there is another rising number emerging Last night, there was another rising number emerging as a ray of hope for Kenyans that infection is not a death sentence. It was no April Fool's joke from the government that two patients, Brenda Ivy and Brian Orinda, have recovered from the coronavirus. Those two represent the faces of hope for Kenyans as the total recoveries now stand at 3, as Eunice Omolo brings us this welcome report.
A clean bill of health handed to patients 1 and 3, a certified indication of recovering from COVID-19, bringing the total to those who have recovered to 3. Brenda, Kenya's first confirmed case, arrived in the country on 5th of March from the United States through London and went into isolation at the Magathi Hospital 3 days after landing. She tested positive on 12th, and on Friday the 13th, the Ministry of Health announced her case as the first case of COVID-19 in the country. 23 days later,
I think I may have contracted the virus in London or on the plane back to Nairobi. So after landing in the country, I had a cough 3 days into landing in the country. So when I suspected they might have been something, as a responsible Kenyan citizen and a patriotic Kenyan, I decided to watch the response of my body for 1 day. And then the next day, that is when I presented myself to Magathi Hospital. The nurses were also, I think they were also, under some pressure because it's the first patient. They have not seen this before, but they were really nice. They were very supportive, the doctors as well, and the cleaners who came to clean my room. They used to talk to me a lot because sometimes I was very emotional, but I would like to assure everyone, all the Kenyans, that this is something that can be managed. It's treatable.
Through Brenda, the government was able to trace 23 contacts who were in contact with her on the plane and 22 others locally, among them Brian Orinda, who became patient 3.
I got it from the community transmission, what the ministry is calling that. So immediately Brenda's results came back. I'd like to thank the government, your government, because they reacted very fast. They came for me wherever I was. They took me to a government facility and I was tested, and immediately the results came back as positive. The government, your government again, embarked on treating me for the past 2 weeks or so. And as a result of that treatment, I've recovered. I'm feeling much, much better now, like I was before.
Patient 2, who was also one of Brenda's contacts, was the first person to recover from the disease. Brenda and Brian today had a live call with President Uhuru Kenyatta, who applauded them for their role in tracing other contacts who are on treatment or in quarantine for monitoring.
Let us follow the example of these two wonderful Kenyans who have shown us that you can come forward, you can isolate yourself, and ultimately you can be treated and recover from this deadly virus.
The 3 recovered cases draw a silver lining around the thick cloud of COVID-19 pandemic in the country, as Kenyans are urged to continue being mindful of their neighbors and to seek medical attention as soon as they realize or they notice signs and symptoms of COVID-19. Eunice Omolo, NTV, Nairobi.
Well, that was our top story last night. Now, for the latest immediate update on the coronavirus, we cross over to Mandara County, where Martin Mora is standing by. He tells us fumigating the streets there. Martin, how is the exercise going on?
Yes, good morning from County 021 here. As yes, it's a bright Thursday morning. Let me say, despite that, we have Actually, people here are in a panic mode. The government has reassured people that all is under control. This is the panic is being brought by after yesterday it was announced that Murang'a is among the counties that have been affected. Actually, it is believed that one patient, I'm not sure if it was a gender, if it was a male or a female, who was said to have traveled abroad. His results were released yesterday, and he said that the victim turned positive. So people are in a panic mode, but there are rumors or words spreading around that this person might not have reached Murang'a. Others saying that he might have originated from Murang'a. So it is not yet confirmed, but we'll be talking to the CEC in charge of health to give us more information about the victim. Not the name of the victim, but if the victim actually was brought from Murang'a or who was just quarantined in Nairobi, but he traces his origin in Mandara County. Now, after this, after what came up yesterday, the county has continued to put an array of measures to ensure that these cases are not reported here. For today, I can tell you that Kakuzi Public Limited Company, in conjunction with Murang'a County government, today will be going around some two sub-counties, that is Kiharo here in Murang'a East and Mathioya. They'll be going around spraying the markets and also the streets, trying to fumigate to ensure that they try maybe disinfect the markets and also the streets, even the air. Something else that is happening here, I can tell you, is that Murang'a County has already banned market days. It has already banned salons. It has already banned kinyozis, or better known as barber shops. These are just some of the measures that are trying to ensure that this COVID-19 is brought under control. Now the governor, he has already repeated and continue repeating, is asking the county government. Also, Kiharo MP Ndende Nyoro mentioned it yesterday. They're asking the county government, the national government, sorry, to start something that they are terming it as county lockdowns, just to ensure that matatus do not move from one county to another. The inter-counties are traveling. They're saying that this can also help in one way or another to stop this transfer of this COVID-19 from one county to the next. Yesterday we also saw the Murang'a Women Rep, who is also the chair of the National Assembly Health Committee chair. Yesterday she was distributing what do we call them, face masks to various border operators in Murang'a County, and also she was giving water tanks and sanitizers to the border operators, and her call is also the same. People are being urged to adhere to the regulations and guidelines that have been granted by the government, including those who are not going to work, to stay at home, so that these infections can be brought to control. Because every new day we are hearing of more cases cropping up. So they are asking people to kindly adhere to the regulations, including washing of hands, staying at home, sanitizing, so that this disease can be brought to control. Something else that she brought along is, as the chair of health, she asked the county government to hire the nurses, because the money, health professionals, because money has been set aside by the national government. She's asking the county governments to please hurry up before these cases become difficult to handle. He's saying that if these people can be hired in good time, before the cases are become difficult to handle, it is easier than when already the pandemic is here in the various counties. Something else that she brought or said yesterday was asking the national government to kindly ensure that they have ensured the health workers, the people who are currently directly in contact with the victims, that is the COVID-19 victims or patients, or who are under quarantine and isolation. She's asking the county government and the national government to ensure the workers and their families, saying that these people have really put their lives on the line for the sake of this, to try and control or bring down this pandemic. Those are some of the few things that we'll be following up on. And as I have mentioned, the county today is fumigating the markets, is fumigating the streets, and we'll bring more on a subsequent bulletin. Back to you.
All right, Martin, looking quite colorful there and speaking to us from Mandara County on the interventions that have been put in place by that county government. Now we move on to the interventions that have been put in place in the ICT sector, and we're joined by the Acting Director General of the Communications Authority, and that is Mrs. Mercy Wanjau. We are happy to have you with us. How has the coronavirus affected your operations? Are you, for instance, speaking to us from home?
Thank you very much for this opportunity. Indeed, the coronavirus situation has affected us in a very significant way. At the workplace, we have had to scale down our operations significantly, with about 75% of the staff working from home and the 25% working on shift here. This has been a real disruption because it has caused us to really pull up our business continuity processes and to find a different way of working. This has led to a situation where we are having a lot of online interactions, online meetings, and as a result, trying to ensure that we are able to meet our service requirements. Because in this moment, and being within the essential services sector, our commitment to ensure access to communication services, public services that are powered on the ICT platform, and access to emergency platform is a commitment that we have to live up to at this time. And we are able to do it. It's quite a bit of an adjustment, but we are on track.
As you just said, ICT is an essential service. How are you making it possible, especially now at a time like this? It's critical that the government, for instance, is able to disseminate information in the shortest time possible. It's critical, actually, to the function of the country in the face of the coronavirus. How is the Communications Authority working to make that possible?
Indeed, this season has really demonstrated how ICTs are at the backbone of supporting the fight against coronavirus. The ICTs have redefined how we are living, how we are transacting, buying goods and services, how our children are learning, because all the children are at home, learning through TV, through computers, through the radio lessons. Indeed, these are the services that through our licensees we enable. I'm happy to report that the licensees have risen up to this situation to provide discounts here and there, to ensure availability of quality of service, to ensure adequacy of speeds that are now required, where parents and children alike are relying on the platform to work, to study, and the like. We also have reached out to another segment, the courier operators, encouraging provision of temporary lowering of tariffs to ensure that the movement of packages and packets is more affordable because of the heightened reliance of this on this platform, in the same way that the mobile operators have lowered the transaction fee for access to money on the mobile money platforms.
All right, so all these sectors have risen to the occasion, as you've said, but there are also those who are guilty of spreading misinformation. How are you dealing with those parties?
Yes, this I think is the sad part of it, and government has been very, very intent and strong about discouraging the issue of the spread of fake news. As you're aware, Kenyans are some of the highest users of social media platforms and technology worldwide. We rely heavily on radio, television, social media for information. And at this time, everyone wants to know what is happening in as granular detail as possible. And as this is why anyone who has access to the platform is being encouraged, and indeed is being cautioned, to use this platform very, very responsibly, because putting up news that is inaccurate, is false or misrepresented, has the capability of spreading distress, hopelessness, and fear. Just looking at the guidelines that government has disseminated, this is the time to step up for positive behavior change, social distancing, washing of hands, sanitizing of surfaces, keeping to a schedule that would enable productive work and rest, at the same time. And I would like to just share some of the kind of incidences that we should all be aware of in this season. One of them is the incidence of SMS scams. Because of this, there's a very high reliance on the ICT platform right now. Scams are all over. Be careful about the site that you look to for information. Look out and find if the information is sensational, or there are typos, or the site is not secure. This calls, for a pushback. And look to sites like the Ministry of Health, for example, for accurate information on the evolving situation. This is also a time when people are relying heavily by using the mobile money platform, using their credit cards and the like online. Be careful about release of personal information or requests to release information that is very sensitive. Who you are, your credit card details, your ID details, your PIN numbers. Be very cautious about that, especially if it is a site that you have not dealt with. Lastly, is the incident of sensational emails being sent saying something like, did you know that this is the cause of coronavirus? Are you aware that this and this has happened? And once you click that email because of curiosity, this is how viruses and malware get out onto your machine, and the machine gets infected. So let's look to the directives of government. Indeed, government is taking a multi-agency approach. Let's look to that direction for information. Let's look to trusted sites like the World Health Organization or the Center for Disease Control for information, and not get excited and curious to pick on every other email or message that comes on our devices.
Okay, and you've talked about scams. You've talked about how children are using these platforms for their education, and also you've talked about, plus there are also those Kenyans who are perhaps Netflixing and chilling if they're able to do so. So you've talked about briefly about cyber security, but as far as the children particularly are concerned, what advice would you have for parents as the children interact with these devices?
Indeed, now children are really having a lot of FaceTime on their computers or phones for educational purposes and entertainment purposes. One of the flagship initiatives that we have had as the Communications Authority of Kenya is the Child Online Protection Initiative, because the children of today are digital natives. They consume a lot online. The encouragement and the guidance that we are sharing with parents and guardians alike is to be very vigilant with their children, monitor that the children are doing what it is that they are supposed to be doing at that point in time. If indeed they are meant to be studying, consuming educational material, to ensure that the children are not chatting on the side, to ensure that the children are not on social media platforms, have conversations with them to engage and understand the value and the responsibility that comes with engagement on this platform. When it comes to entertainment time, as you're aware, there are so many possibilities online, and the need for parental support to access these services. We do have an initiative that has been very, very keen and diligent on this, and usually has run during school holidays, and now we are having to do it every other day to ensure that parents are keenly aware of this situation and protect their children. Children are very vulnerable to unintended consequences on this platform, for example, cyber stalking or even cyberbullying. This can easily happen that now children are on the platforms quite a bit. Of course, this is not to say that all the time children should be on the screen. There should be time away from the screen, doing house chores, going outside, and even as they do that and interact, to ensure that they also are able to exercise the guidelines that have been given to keep distance with others, and to observe the hygiene measures that have been so generously shared over the last couple of weeks.
Okay, so parental supervision is critical. Perhaps, are you able to tell us how the sector is performing in the face of COVID-19, or is it a bit too early to tell?
I think it's a good time because we just released our sector statistics, and they demonstrate quite a spike in usage. These are sector statistics as at December. So seeing as we are in April and seeing that there is a very, very high reliance and a shift in the last month or so, this is likely to even be greater. The consumption of mobile money platforms is really on the rise. The consumption of government to citizen services as at 30th December was 9.7 billion Kenya shillings. You can imagine what it must be now with this kind of a shift. From a regulatory perspective, we have also looked at that space and said, what is it that these platforms, what is it that the sector can contribute, given that it is the backbone of to support the fight against COVID-19, and some certain regulatory measures have been taken. Some of them, for example, as you may have noticed, is the opening up of the educational TV channel that is run by the Kenya Institute of Curriculum Development to ensure that education is available to every child in the Republic of Kenya, that children will not be left behind because of this kind of situation. And this information and the content is available on TV and it's available on radio. And this has ensured continuity of education. We also recognize that adults have been left at home, they have to work, they have to spend a lot of time inside, and indeed also looking at some of our regulatory objectives as far as broadcasting is concerned. And the Communications Authority issued a directive compelling pay TV channel providers to enable visibility to all free-to-air channels across the platform, as is required for purposes of universal service to access diverse information and diverse views. We have also been in fruitful conversations with the telcos to ensure that capacity is enhanced for voice and for internet, to ensure that these capabilities are supported with people learning, doing business, working, and doing obtaining their entertainment online, that the speeds that it should be reliable and that systems should be resilient to be able to support this kind of shift that we never quite had time to plan for gradually, but we have successfully been able to shift at a very short turnaround time.
Okay, so that's how you're cushioning the consumer. How are you cushioning the sector players?
Pardon me?
How are you cushioning the sector players themselves? You've talked about cushioning the consumer by ensuring adequate speeds, free to air. How are you cushioning the sector players themselves, the telcos, for instance?
So we do have a range of sector players. We have the telecommunications companies, internet service providers, postal and courier, of them, and we do recognize that these are unprecedented times and the experiences are very unusual and prejudicial for business. So because of this, one of the early initiatives we took was to try and endorse some lines as toll-free lines geared towards small and medium enterprises, that they would be able to obtain information and guidance on how to continue dealing with their businesses at this difficult time. We do recognize and we do honor small and medium business enterprises in this country because they are a big support for this economy. In addition to that is the recognition that payments that were required to be made within certain intervals might not necessarily be forthcoming, and having discussions on how best to meet licensees where they are at, so that we are able to hold each other's hands in this situation, that businesses should not close, that they should be able to continue even with the difficulties that we are experiencing as best as possible to be able to carry on until this season is over.
All right, thank you very much. That's the Acting Director General of the Communications Authority, Mrs. Mercy Wanjau. Thank you for speaking to us this morning. We hope to engage you further as the situation develops. Well, now we cross over to Thank you. We now cross over to Mombasa County, where Kevin Mutai is standing by. Kevin, Mombasa has been identified as a hotspot. Oh, there you are. Mombasa County has been identified as a hotspot as far as COVID-19 is concerned. What are the measures that, or rather, have they escalated the measures that are being taken to mitigate the spread of the virus?
Very true, Olive. And first, I'm joining this broadcast from home, and that is because of the dangers that the virus is now posing. And remember, at first, when the government announced the first cases of COVID-19, Kilifi, as according to many people, thought that would be the hotspot. But as of yesterday, what the government announced, and now we are seeing Mombasa coming second in terms of counties with the huge numbers of infected persons. After Nairobi, that is Nairobi is leading, with Mombasa following with 12 cases, that is people confirmed positive for the COVID-19. Kilifi now lags behind with 8, and Kwale County 1. So a lot of things are currently being done by the authorities here in Mombasa, and what we are learning is that even the law enforcers are calling for more stringent measures, because how this virus is spreading is even scaring even employees of particular of different institutions. As of yesterday, even as we were informed that we limit our interactions in the office, and some of us have been even forced to work from home, and this is because of now the dangers that are being witnessed because of the pandemic. Now over 10 counties in the country have infected persons with COVID-19, and of course also remember, recently, Governor Hassan Joho was among the first leaders from this region calling for a total lockdown, because he categorically stated that this would definitely be a painful process, but for a short period of time, and urging residents within the region to take that matter if at all it will happen. But of course, he has also been one of the key leaders from this region who have also come up with ways to try and help even the vulnerable in the society. We saw yesterday in areas such as Changamwe, Mikindani, people were queuing to be registered. They submitted their details, names, the number of people in their different homes, so that they be ready, because the county government will soon start rolling out a distribution of food items in the most vulnerable areas within the county. But of course, also there are certain concerns that the national government is also preparing for this. Remember, there was a letter that leaked out a couple of weeks ago, and the government, through the Ministry of Interior, denied that particular letter as fake. But of course, also we are receiving reports that the national government is also preparing in case of a lockdown. And remember that Mombasa, Kilifi, and Kwale counties are the only counties with infected persons. But of course, also different measures across the region are currently being conducted. Remember, recently also in the Kongowea market, the county has also remained strict in terms of limiting the number of people visiting the market, and they came up with an idea of setting up satellite markets. There's one in Likoni, there's another one at Tononoka grounds, with the county even waiving extra charges for wholesale traders, so that they can be able to sell their goods in satellite markets to avoid interactions from other people within the market. And of course, we are seeing that although this is currently slowly sinking into people, but of course, I think with the new surge in terms of numbers of infected persons in the region, it is something that I think is slowly sinking.
All right, those are the challenges that come sometimes with working from home. Well, we are now joined by Ahmed Maulid from Mandara County, and he's speaking to the residents there, or rather he's spoken to the residents there on the number of COVID-19 cases in the country rising, or rather the confirmed cases in the country rising to 81. Maulid, what have the residents to say about that?
Thank you, Olive. We are joining the broadcast live from Mandara. As you said, the rising numbers of COVID numbers in the country have raised a lot of concern across the country. Mandara too have not been spared, that now people have now started believing that corona is real and they should take the necessary precaution machineries. Yes, Mandara has first confirmed the first suspected coronavirus in the county yesterday afternoon. One patient had been admitted in Elwak Referral Hospital, who was, according to the county governor, Ali Roba, said that one of the suspected patient traveled to Mandara from Nairobi days ago and was screened at the level of the airstrip, and it was observed that he had 39 degrees, which prompted health personnel at the airstrip to pick him and admit him at the isolation ward in Elwak Referral Hospital. His samples have been sent to Nairobi and is waiting and is now remain subject of confirmation. For the coronavirus, this one that have been across in social media platform in Mandara, that most people now started believing that when one of the first suspected coronavirus has been confirmed in Mandara County, people now started believing that corona is real and the precautionary measures that they should take, the earlier the better. But for now, the county government has put several measures that they want to fight the corona should they knock their doors. And the county government has yesterday officially opened isolation wards fitted with ICU beds and all with ICU beds and fitted with oxygen 100%. It is one of the precautionary measures that they have said that they have put in place to fight the coronavirus. It is all the hospital and the isolation wards have been opened across Mandara County, from Mandara East, Elwak, Takaba, Banisa, Kutulo, which is the entry point of the county, where all county health officials have been placed to make sure anyone coming into the county should be screened and taken the necessary measures. And Duxi's mosque and all Duxi's madrasas all have been closed, and for now Mandara County seem to be locked down. Maybe in the coming days if things get worse. Olive.
All right, thank you, Maulid. Maulid speaking to us from Mandara County and informing us of what action has been taken as the number of COVID-19 cases in the country rise. Well, the government announced the largest number of coronavirus cases yet, and that is 22 people yesterday. 22 people tested positive for the coronavirus, bringing the number of infections in the country, as we said earlier, to 81. Health Cabinet Secretary Mutahi Kagwe says the rate at which the virus is spreading is alarming, and that may inform the government measures on whether to impose stiffer measures soon to control the spread. NTV's Sharon Baranga with that report.
It is 19 days since the government announced the first case of a patient who had tested positive for coronavirus in the country. The number has kept increasing with each update from the Ministry of Health, and today 81 people have been infected.
Over the last 24 hours, we have tested over 300 Kenyans. Out of those, 22 have been tested as positive. This is the largest number that we have received in a single day.
From these new cases, Mombasa County tops the list with 7 infections, followed by Kiambu, which has 2 infections. Kakamega, Kilifi, Machakos, Murang'a, Nyamira and Nairobi counties all have 1 case each. The government is in the process of tracing close contacts of the 81 people.
Quarantine yourself if you know you have traveled, because so many cases are out of people who traveled, who are asked to quarantine themselves, and they did not.
And this is the kind of treatment being administered to those currently admitted at Mbagathi Hospital.
This being a viral infection, there is no specific treatment. The treatment we offer as clinicians is basically supportive treatment. Supportive means we respond to the symptoms that you exhibit as we take care of you. Like if you have a fever, we give you something to bring down your fever. If you are coughing, we give you something to suppress the cough.
Health Cabinet Secretary Mutahi Kagwe says Kenyans should prepare themselves for stiffer measures from the government if the number of infections continue to increase. But the decision rests entirely on you. That is, if you choose to follow directives such as maintaining high levels of hygiene as well as social distancing. Sharon Baranga, NTV, Nairobi.
All right. Yesterday, the biggest story of the day was the recovery of patient 0. Is it patient 1, as President Kenyatta said? I'll need to get some clarification on that. And that is Brenda Ivy. And our very own Dennis Okari sat down with her to get a sense of what it was like and also to hear what her experience was. And she had a very positive and encouraging message that it is possible to recover from COVID-19. But of course, there are a lot of factors that are involved. Here is that interview.
How has been your journey from the United States coming into the country to the point when you knew that you have some symptoms and you sought help from the government?
When I first took the flight from Nairobi to the US, there was only a few cases of the virus, but then that time it was only in China, I think. It hadn't really gone outside the country. So that time, so I took the plane to the US and then I stayed there for about 2.5 months. Then when I took the flight back to Nairobi, that time now I think it had gotten to some parts of Europe and there were a few cases in the US. So I wasn't really, I wasn't so scared about it. I wasn't so nervous, but I had surgical masks with me and I had everything, the sanitizers. So when I got on the airport, I was the only one actually in the airport in Cleveland with the masks on, and everyone was looking at me thinking I'm crazy. So anyway, so when I landed in London, that's when now I became a bit worried, because then we were using so many trays, so many people were using so many trays, the security was touching everyone's stuff, but and I still had the sanitizers and the masks on, but that's when we went through the security and we took off our masks, and then we landed, we got into the plane, and then that's when we came to Nairobi. So I think I may have contracted it either in London or on the plane back to Nairobi.
So earlier you said that you had the masks, you had the mask on and you also had the gloves. So in London, were there many people who were also wearing the masks?
No, that time there was nobody wearing the masks. There was no one.
So in the plane coming to Nairobi from London, right? Were you thinking about this virus? Were you thinking about your surrounding? What was going on through your mind?
The first instance, I was very concerned about my health when I got into the plane. But so that's on the plane, I did not sanitize at first. So I sat on it, and then 30 minutes into the flight, that's when I started sanitizing the area around me.
So from London to Nairobi, when you got to JKIA, what happened? What sort of procedure did you go through as you're coming into the country?
When we got into the country, the first thing they did, it was screening. Everybody was screened, all the passengers. So the temperature was checked, and the temperature was very fine, including the temperature of the passengers next to me. They were just okay.
So everything was okay as you went through JKIA, so you went home?
Yeah, I went home, and when I think it was around March 7th, that's when I had the first cough. It just started as a tickle in the throat. So then it turned into a cough about 3 hours later, and then the cough came with just a mild headache that went away after 1 day.
At first, when you started coughing, did you think that, well, this is it, or did you think this is just a common flu?
No, the first cough, I just thought this is a normal flu. Then someone joked about it and said maybe it's corona. Then we laughed about it. We said no, it can't be common. My temperature was just fine. There was no fever. So that's the next day is when I became a little concerned, and I called the people who were seated next to me on the plane, and I asked them how they were feeling. They said, one of them said they were having a cough and a fever.
And were these Kenyans?
Yeah, one of them was a Kenyan.
So you exchanged contacts when you landed, you were checking up on each other?
Yeah, we were checking up on each other. So it helped that I had their contacts, because when they told me we are also having a cough, that's when it came to my mind and I said, this may be the virus. So that's when I now just took a time. I took one day to watch my body and to watch how I was responding to it.
So at this time, were you worried about the people you're interacting with at home?
I was very worried because I'd interacted with people in the house. So that was a concern for me. And we talked about it with the people I was living with. I told them there's a chance that this can be the virus. And if it comes that way, I would like all of you to just come out and also tell the ministry that you had been in contact with me. We had that talk with them before I went to the hospital.
So second day, you're still coughing. Then what did you do?
On the second day, there was no cough. The cough had gone away completely. There was just a small headache and then it went away. So by the time I was presenting myself to the hospital, I didn't have any symptoms. It was just, I told them I was having a cough yesterday, and it was, the cough was a little too consistent. It was coming too many times in 1 hour.
Who did you call?
I called Mbagathi Hospital, and then I also called the toll-free number. Yeah.
So they picked you from the house, or you drove yourself there?
The toll-free number wasn't, I don't know, I think it was busy that time, and the numbers from Mbagathi Hospital were also busy. So that's when now I decided to take a ride to Mbagathi Hospital, and they were very, very helpful when I got there. They were very concerned and they took me seriously, because if they hadn't taken me seriously, I probably would have also just gone back to the house.
So the process when you reported and they treated you nicely, like you've just said, what was the process like for you, and up to the point when now they told you you're positive? And did they tell you, or did they put it in writing? How did they disclose this to you?
When I got to Mbagathi, I asked for the isolation center, because I'd read on the news, I think there was an article about there being an isolation center in Mbagathi Hospital back when I was in the US. So when I got here, the first thing I asked my friends, do you know any isolation center? And then we Googled, we got the toll-free number, and we got the information. So when I went to Mbagathi, I asked them, where is the isolation center? And then they pointed me in that direction. So I went there and presented myself. And the nurse there called the Kenyatta National Hospital. And then Kenyatta came for me. And then that's when I got to Kenyatta and I got the test done the next day.
So the test came out positive after how many days when you were there at Kenyatta?
I think, I'm not too sure, but I think I may have spent 2 days in Kenyatta. It was 1 day. Yeah, it was 1 day. Then the tests were taken, and the test came back after 1 day. Yeah.
How did they break the news to you?
I didn't get the news. I got it from the media when it was announced. So that's when somebody called me and told me, Ivy, I think that's you. And I said, no, it's not me. It can't be me.
So the doctors had not told you that you're positive then? You got to learn this through the media?
Yeah. But I think, the doctors were trying so hard to do so many things at once. They were very busy. There's the protocol, trying to organize so many things. So I think that may have been part of it. And I don't really blame them. I know there was so much confusion, but they had my best interest in their hearts. They really had my best interest, because after that they called me and they comforted me, and they were very, very nice. They kept calling me, and they made sure that I had everything I needed.
So is that the point when you knew that you are patient number one?
Yeah, I got it from the media. That's when now I kind of joined the dots together, because there was that, it was that, the media actually said I was 27 years old. But then I was like, no, but I'm 26, that's not me. but I connected the dots, because everything fits. Young, jovial, in high spirits, she's eating and she's even talking to us. That's what the CS said.
And you knew that's you?
And I knew that was me, because I'm always in high spirits and I'm jovial.
You still are, which is really, really great. I mean, coming out of this and speaking the way you're speaking is really, really inspiring. But at that moment, take us to that moment when now the thought settled in your mind that it's me and I'm positive. What was going through your mind?
I was crying. I was crying and wailing. I was just, I was so shocked. And plus, I knew I was the only patient, so that was a little scary for me. And I called, my parents called me, my sisters and my brothers, and they were all trying to comfort me because I was breaking down. I was in tears, and I couldn't believe now. I was just wondering, like, how did I catch it? How do I have it when I'm not even showing the severe symptoms for this? It's just very mild. So, yeah, I was very, very scared. And I cried, which is normal. I think everyone will have that at some point.
What will be your message to a lot of young people who think that they can't get this because there's a lot of talk within the estates, within the country, and even other places that young people can't get this. You're only 26 years old, but you had it. And then others would assume that I just have maybe just a small cough. I don't have the full-blown symptoms and I can't get it. What would be a message to them?
My message would be, regardless of how you feel, if it's just a cough, I'm not a medical expert, but I know mine came as a tickle in the throat and then a cough and a headache, and that was just about it. Maybe a runny nose for 5 minutes, and that was it. So if you suspect that you have it, you should just self-isolate. That's the first thing, and call the Ministry of Health, because they've given us all the guidelines. Call the Ministry of Health and make sure they know it. They will come for you and you identify. You should, as a responsible Kenyan, don't go around spreading it. When you suspect you know it, just self-isolate first thing and call the Ministry of Health. They will come for you and they will give you all the assistance you need. If you need any information from them, they will give it to you. And you should be ready to make sacrifices, such as being quarantined for any number of days. You should just be comfortable with that, because this is something that we all have to make sacrifices as a country. We'll all have to be painfully uncomfortable for a limited period of time so that we can save the future and so that we can save the people who are vulnerable. And it would be very, very selfish if you put yourself in a place where you're spreading it to other people. It's very selfish.
So Ivy, how many days were you in quarantine as you're going through the treatment?
I've been in quarantine for 22 days now. Yeah.
And through that period, you were giving out contacts of the people that you had interacted with, and the government was following up on them?
Yeah, the government was following up on those people. And I was also asking those people, are you being followed up on? They were saying, yes, we are being called every day. So those people were quarantined, and then after being quarantined for a number of days, they were tested. And then after being negative, they were released, but then still made to quarantine where they went to for another 14 days.
I mean, the president has really commended you for cooperating with the government and saying that you are giving out these contacts and you are responding very well and very positively, and you look like a very, very positive person. Was there a point when you were feeling, as patient number one, perhaps you're responsible for infecting other people? Did these thoughts cross your mind?
First of all, I didn't bring this on myself. That's the first thing I understood. It could have happened. It was a matter of when, not if. So I knew that was just something that I had to take a step to, I didn't put the blame on myself. I didn't put it on anyone else or where I got it from. That's something I did not do. But then that's why I took the step to make sure that I was isolated and treated, so that it would spread that and suppress it for any other person who I had maybe been in contact with. And thankfully, because of that wise decision that I made, there was only one person whom contracted it from me. So had I not come forward, it could have been so many people, hundreds, and probably even to vulnerable people. So that's something you have to think about when you have this virus.
What were you doing to, to keep you, staying positive while you're in quarantine? What were you doing?
Sometimes it can be a little overwhelming, because during the day you don't know. Sometimes it can be a little overwhelming. But then for me, I was talking to the doctors, so they were advising me, you can do this, you can listen to music, you can also get audiobooks, and try to stay away from negative information. There's a lot of information going out there on social media sites from sources that are not even credible. They are not scientific research journals or anything. That's the information you're supposed to stay away from. Keep positive and talk to people who uplift your spirits.
Is this the first day that now you're being released to go home?
Yeah, we were just discharged maybe a few hours ago. Then that's when we came here. So
how are you feeling?
I haven't gone home yet.
But how are you feeling, the thought of just going back home from all this?
I'm excited because the last time I left, the last time I was outside, everything was normal, right? So everything was normal. People were going to work, to school and everything. So now it's things have changed from what I've seen on the media. So I'm excited to go outside.
You can't wait to go back to your normal.
Yeah, I miss the sun so much. Yeah, we were able to go out to the sun when we were in quarantine, but then there's that feeling of being able to really go out.
Brian is a bit overwhelmed at this point in time, and just talk about the issue of stigma, because there are a number of stories that are going out there of people who are being suspected of having symptoms of COVID-19, and there's the whole issue of stigma around them. How will you address that? What would you want to say now that you're going back to the community?
I'd like to say I'm not afraid of stigma because first of all, I'm a person who doesn't stigmatize other people regardless. So I'm not afraid of the stigma because I know there are some people who might be scared. People are afraid of what they don't know. So the more information you get about this thing, the more you learn that people can actually get treated for this and managed very well, then the stigma will go down. But there shouldn't be any stigma because this is something that is treatable, right? Yeah.
Brenda Ivy, the face of hope. That interview concludes our special coverage this morning. I will see you at 1 p.m. But we do have NTV Sasa coming your way at 11 a.m.